Hi, my name's Dr. Chrissy Hilrod, and I'm in North Carolina right now at the Young Survival Summit. It's really exciting. This is the first time that I'm going to be meeting any other breast cancer survivors, really, especially young, early diagnosed women, and this will be the first time that I'm able to talk to anyone and make some new friends. One of my new passions is medical trauma. Since I've experienced so much of it, I really became passionate about learning how to treat it and what to do when there are deeply felt psychological impacts from having medical trauma and the development of PTSD because of it. I'm completing a course and ultimately a certificate program at Xavier University studying under Dr. Michelle Flom. She had the experience of medical trauma during giving birth and ultimately wrote the book on treating it. And it's the only book out there. And so I've studied with her, and as my capstone project, I'm creating a library of definitions about medical trauma and helping spread the word about the information that's in her book and all of the many concepts that are growing since she's written it, and just creating a place to share information. First, the definition is from the patient point of view, and that's really important because a lot of the other language that we use really is from the point of view of other people in the room. So like you may have heard of vicarious trauma or moral injury, and that's all about what's going on with the other people. Now that we have a working definition of what medical trauma is, and it's focused on the point of view of the patient, I really like this, and I'm hoping that we can spread the word on this definition and go forward from here in terms of research and treatment and any options for us. Medical trauma occurs with direct contact with the medical system. It may sound a little bit obvious, but we want to lay that groundwork. So we want to put that bubble around what these experiences are and what we're talking about when we say medical trauma. It could be the dentist's office, it could be an OBGYN appointment, it could be something more emergent like an ER visit or an ICU stay. There are a lot of ways that we each interact with the medical world. Next, it's important to know that medical trauma develops through a complex interaction of a lot of different factors. So this includes the patient, so who you are. That also includes your history. The factors of the medical setting are important. So environment, like what was it like while you were there, and interactions with medical staff. And then we also have the diagnosis or procedure that was actually occurring. There are many characteristics of the environment, staff, diagnosis, or procedures that can influence the patient's response. Another important fact to know about medical trauma is that it can have some really important psychological impacts. You can develop clinical or subclinical levels of PTSD. You could also develop other mental health issues that impact your work, your relationship, your leisure activities, your spiritual activities, your sense of self, your body image. There are so many ways that medical trauma can impact your psychological self. The last thing to remember is that the patient's experience is the key to understanding the overall impact of the medical trauma experience. I'll be talking more about medical trauma every day, so comment if you have any questions that you'd like me to answer.